The physiology of the respiratory system refers to the study of how the respiratory system functions to support gas exchange, acid-base balance, vocalization, protection, and olfaction. Below is a comprehensive and detailed overview. Physiology of the respiratory system. 1. Overview of respiratory function. The primary function of the respiratory system is to facilitate gas exchange, oxygen, O2, intake for cellular metabolism, and carbon dioxide, CO2 removal, a waste product of metabolism. 2. Major components. Upper respiratory tract, nose, nasal cavity, pharynx, larynx. Lower respiratory tract, trachea, bronchi, bronchioles, alveoli. Lungs, site of gas exchange. Diaphragm and intercostal muscles, responsible for ventilation. 3. Phases of respiration. There are 4 major phases. A. Pulmonary ventilation breathing, inhalation, active process, diaphragm contracts, moves down, thoracic volume increases, air flows into lungs. Exhalation, passive process, diaphragm relaxes, thoracic volume decreases, air pushed out. B. External respiration, exchange of gases between alveoli and pulmonary capillaries. O2 diffuses from alveoli to blood, CO2 diffuses from blood to alveoli. C. Transport of gases. O2 is mostly carried bound to hemoglobin in red blood cells. CO2 is carried in 3 forms, 70% as bicarbonate ions, HCO thiones, 20% bound to hemoglobin, carbaminohemoglobin, 10% dissolved in plasma. D. Internal respiration, exchange of gases between blood and tissue cells. O2 diffuses from blood to cells. CO2 diffuses from cells to blood. 4. Mechanism of breathing. Breathing is controlled by pressure gradients. Boyle's law. At constant temperature, pressure is inversely proportional to volume. During inspiration, volume, pressure, air moves in. During expiration, volume, pressure, air moves out. Muscles involved. Diaphragm, primary muscle, external intercostals, elevate ribs during inhalation. Accessory muscles, used during forced breathing, e.g. sternocleidomastoid abdominal muscles. 5. Neural regulation of respiration, controlled by the respiratory centers in the brainstem, medulla oblongata and pons, medullary respiratory center, dorsal respiratory group, DRG, controls inspiration, ventral respiratory group, VRG, controls expiration, pontine respiratory group, modulates rhythm and smooth transitions. Chemical regulation of respiration, chemoreceptors, monitor blood levels of CO2, O2, and pH. Central chemoreceptors, medulla, respond to CO2 and pH. Peripheral chemoreceptors, carotid and aortic bodies, respond to O2, CO2, and pH. High CO2, hypercapnia, breathing rate. Low O2, hypoxia, ventilation, less potent stimulus. 7. Gas exchange and transport. A. Partial pressures. O2 moves from high pressure alveoli to low pressure blood. CO2 moves from high pressure blood to low pressure alveoli. B. Oxygen transport, 98.5% bound to hemoglobin, 1.5% dissolved in plasma. C. Carbon dioxide transport, as bicarbonate, 70% bound to hemoglobin, 20%, dissolved in plasma, 10%. 8. Lung volumes and capacities. Tidal Viva. Air moved during normal breath, 500 milliliters. Inspiratory reserve volume, IRV. Additional air inhaled, 3,000 milliliters. Expiratory reserve volume, ERV. Additional air exhaled, 1,100. Residual volume, RV. Air left after max exhalation. Vital capacity, VC, equals TV plus IRV plus ERV. Total lung capacity equals VC plus RV. 9. Surfactant and lung compliance. Surfactant, secreted by type 2 alveolar cells, reduces surface tension, prevents alveolar collapse. Lung compliance, measure of lung expandability. High compliance equals easy to inflate, e.g. emphysema. Low compliance is hard to inflate, e.g. fibrosis. 10. Acid-base balance. Lungs help maintain P by regulating CO2 levels. CO2, pH acidosis, EPH alkalosis. Rapid adjustment by respiratory rate is a compensatory mechanism in acid-base imbalance. 11. Defense mechanisms, nasal hairs, filter particles, mucociliary escalator, traps and moves debris up and out. Alveolar macrophages ingest pathogens in the alveoli. Cough and sneeze reflexes expel irritants. 12. Additional functions. Voice production. Air passes through vocal cords in the larynx. Olfaction. Air carries odorants to olfactory epithelium. Thermoregulation and humidification. Air is warmed and moistened before reaching lungs. Conclusion. The respiratory system works through a finely coordinated interaction between mechanical processes, ventilation, gas exchange, transport systems, and neurological control. These elements ensure that the body's tissues receive adequate oxygen and that carbon dioxide is efficiently removed. Here are 5 key applications and implications of respiratory system physiology to nursing praten. Assessment and monitoring of respiratory function. Application. Nurses use knowledge of respiratory physiology to assess breathing patterns, lung sounds, oxygen saturation, and arterial blood gases, ABGs. Implication enables early detection of respiratory distress, hypoxia, or acid-base imbalance, allowing timely intervention. 2. Oxygen therapy administration. Application. Understanding gas exchange and oxygen transport helps nurses safely administer and titrate oxygen therapy. Implication. Prevents complications like oxygen toxicity or CO2 retention, especially in patients with COPD. 3. Positioning and airway management. Application. Physiological knowledge guides proper positioning, e.g. Fowler's position, to enhance lung expansion and drainage. Implication. Promotes ventilation perfusion matching and reduces the risk of atelectasis or aspiration. 4. Support in mechanical ventilation. Application. Nurses caring for ventilated patients must understand pulmonary mechanics and gas exchange to monitor ventilator settings and patient response. Implication. Prevents ventilator-associated complications and ensures adequate oxygenation and ventilation. 5. Patient education and preventive care. Application. Nurses educate patients on breathing exercises, e.g. pursed lip breathing, incentive spirometry, and smoking cessation. Implication. Enhances patient self-care, reduces risk of respiratory complications, and promotes lung health. Thank you. Have a nice day.